Hello, everybody. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio, where we educate, enlighten, and entertain. And I want to thank Lillian Caldwell for sending me this press release, which I'm going to talk about in a couple of minutes. I want to thank Jeannie White, station manager, who writes the blog, produces the show. Please read the blog for the information. Folks, you know I'm Chatting with Betsy. If you've listened to me, you know I'm very passionate about mental health awareness. And there's a crisis facing this nation today. And, you know, on Chatting with Betsy, I will pop open the lid on a taboo and talk about it. And this crisis needs to be talked about. And I want to read something that I received. It's from the American College of Emergency Physicians. ER doctors are afraid to seek mental health because of the stigma. 73% are afraid of stigma. This is unacceptable. 57% are afraid of professional reprisal. This is unacceptable, folks. And if anyone's listening who is in charge of licensing doctors and testing doctors, you need to come on my show because we need to discuss why you do this to emergency room physicians and other doctors. It should not be held against any doctor to go for mental health. And personally, in my own opinion, I would rather a doctor that I go to an emergency room have gone for counseling and had themselves together than to be on drugs or have an alcohol problem because they couldn't receive the help that they need. Why is it that a sports player can get surgery on their injured limb? It's acceptable. But an emergency room doctor or any other kind of doctor, if they are having a crisis, especially with this COVID, it's held against them to get mental health. This isn't right. It's not right at all. So you see how passionate I am. And I want to welcome and thank Dr. Nassef for coming on. She is representing the American College of Emergency Physicians. And I want to welcome you, Dr. Nassef, and thank you for coming on, Chatting with Betsy. I really appreciate it.
Betsy, thank you so much for having me.
Oh, you're welcome. And Dr. Nassef is a doctor in the state of New York. Now, New York was number one with COVID. New Jersey, where I live, was number two, right behind. And I just have to say, Dr. Nassef, before I start to interview you, I want to thank you and all emergency room doctors around the world for doing what you do, and I support you 100%.
Thank you so much.
What you do, you're welcome. You know, folks, I've worked in the emergency room. I'm not a doctor. I'm a licensed practical nurse. I worked in the emergency room. It is high adrenaline. It is so much stress and pressure. That's under normal circumstances, okay? You throw in COVID, and people were dying. It was like a war zone. Doctors are going to have post-traumatic stress from this. Nurses are having it. This old-school thinking has to stop. And I have a big mouth, so that's my soapbox. But Dr. Nassef, if you could please tell us your experience, what it was like working with the COVID, and how did you manage?
Absolutely. Thank you so much for, again, bringing light to this very important issue. I will start by kind of just saying that, yes, I'm in New York, which, became the hottest spot in the world for COVID. And personally, I was actually a new mom at the time when everything was just starting. was starting to surge in the city and surge in the state. And so it was kind of the double layer of anxiety for me. I was struggling to become, to deal with being a new mom, but then all of a sudden, as an ER physician, and, my husband's also an ER physician, we both were kind of thrust into this war zone that was COVID, and we didn't know what we were doing, and we didn't know what we were treating, and we didn't know what kind of risk we were taking, especially bringing that home to our new son. But, kind of reflecting on it, and when I say reflecting, I don't mean we're, looking at it in the rearview mirror. I mean reflecting on the experience we've had so far, because as, everyone knows, it's ongoing and looks like it's picking up again. I have 3 words, and those 3 words are just fear, grief, and anxiety, and we all have experienced so much of that we need to process and kind of deal with so far.
Absolutely. And I think, in my opinion, hospitals should offer emergency room physicians and other personnel free counseling to deal with what you all went through. And it shouldn't be shoved under the rug like in the old days. And it shouldn't be said to a physician, suck it up. You know what you were getting into, your emergency room doctor. That thinking just has to stop. I can't say it enough, because yes, doctors, an emergency, yes, you know how to handle your, the day-to-day, and that's stressful enough. But the fear of COVID, you didn't know what you were dealing with. You might not have had enough equipment. You saw people dying more than normal, than your usual.
Absolutely.
That had to be a stress on your brain. I mean, I know myself personally, I had post-traumatic stress from watching my husband die. And yes, I've seen people die before, but multiply you seeing, how many patients do you see in a day, would you say, Dr. Nassef?
It ranges. So on an average day, we probably see between 15 and 20 patients a day.
And multiply that every day. And maybe half or maybe more had COVID during the crisis?
During the crisis, there was a time in the crisis where every single patient pretty much that came into the emergency department had COVID. Even when things were cooling down. So if a patient came in with like an ankle sprain and you happen to kind of just maybe get an x-ray of their chest, we would see signs of COVID. So there were almost weeks on end, it seemed, where everyone just had COVID and we were just surrounded by it. So it was very, 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 it was vicious when it started, and it was vicious for a few weeks.
And how many would you say, approximately, did you see die in front of you?
Honestly, it's a little bit difficult to remember. The hospital was overwhelmed, and sometimes the patients would come in and they would be either dead or about to die. Sometimes they would come in actually looking pretty well. And the hardest thing was seeing those patients who looked good initially slowly deteriorate and kind of die the next day. In the ER, typically when you see a patient, you either send them home or you admit them and they get a bed upstairs. But because COVID was so overwhelming on our medical system, you could admit a patient and still see that same patient the next day and the day after that. So to be honest with you, we've all kind of lost count. We all lost count, and it was so much more death and illness than we were ever accustomed to.
Right. And that's the point, because you saw, and not just you, emergency room doctors all over, saw so much. I know my pulmonary doctor said going into the hospital at that time was like a war zone. And what happens in a war zone? People get post-traumatic stress. Exactly. Even doctors in the war get post-traumatic stress. And I'm thinking, Dr. Nassef, I know you're young, you may not remember the show, but I'm thinking of the show MASH. And Ellen Alda played Dr. Hawkeye. And in the last episode, the last show, he finally cracked. He saw a mother smother her child so they wouldn't be found by the Chinese, as was taken during the Korean War. And that's what got him.
Right.
So it happens. Go ahead.
Absolutely. I think that's a great point that you're making, like this idea that like one day we're just going to crack, and we're never going to fix this problem unless we learn to address the issue early on and not wait until we crack. And I think just kind of culturally there's always this like drive in us to, like you said, suck it up and just keep it moving and roll with the punches and not really process anything that you're dealing with or a difficult case. And the expectation is that you're going to just be able to do that indefinitely, but everyone cracks at one point. And we have to be able to not let ourselves get to that point. And I think that's the core of this issue. And if we don't start getting treatment and start talking about this stuff early on, that's how we get to the point where, physicians are committing suicide or having suicidal thoughts.
Yes. And then when the physician does suicide, people will say, oh, why didn't they go for help? Oh, they looked good. They didn't say anything. Well, that's the reason why they didn't say anything or go for help, because they would be stigmatized. They may not get their license renewed, and they're looked down upon. The whole culture, Dr. Nassef, needs to change.
Absolutely. There needs to be a revolution.
Yes.
When we're talking about the stigma, it's a multifactorial problem. I think it dates back to when students, doctors are in medical school. So we've actually seen studies where students start medical school with the same level of depression as their non-medical school peers. And then when you compare those students later on in their career, you notice that the rate of depression increases much, much more quicker than the rate of depression in their non-medical peers. So something is happening there that's causing this issue to really flourish among the medical community. And a lot of us suspect that, we all want to kind of hold ourselves to this high standard and that we're invincible and like having a mental health issue, we will be perceived almost as a weakness, and that's not okay. And there needs to be a change in that thinking. There needs to be just like you were saying, the basketball player who hurts their knee sees the doctor and gets an x-ray and gets taken care of. Our brain should be seen as the same way. We can't just kind of suppress these feelings or the sadness and just keep moving, especially in the environment that we work in, one that we're regularly exposed to, death and illness and stress, and we're almost shooting ourselves in the foot by not addressing these things early on.
Absolutely. I just can't even imagine what you all went through. And then I know I did this as a nurse. I did this as a caregiver. I'm sure doctors do it. Do you go home and second guess yourself, or when you're at work, did I do that right? Should I have done, B instead of A? And did I treat this patient like I should have, or was I too rushed? Do those things ever float in your head?
Absolutely. I mean, especially in the ER. So, we have sometimes like 5 minutes max where we can talk to a patient, examine them, get to know them, and try to not only figure out what's going on, but also make sure that we're doing the best thing for them. And that kind of thought process is exhausting. It's just decision fatigue almost. You get tired of thinking like, okay, am I missing something here? I got to move on to the next patient. And so we always do our best to try to get all of that thinking done while we're on the job, and we try not to bring it home. But to be honest with you, sometimes when it's intense or when there's a calamity such as COVID, it's impossible not to bring that home.
I understand that, yes. Yeah, I definitely understand that. I mean, I used to bring my work home, and it was not even COVID, so I can definitely see that magnified many, many times over. I think that doctors are going to leave the field, and then where are we going to be, people? Where are we going to be without doctors? Can you imagine going to emergency room? There's no doctors because they left, because they couldn't get their mental health taken care of. That's really a discrimination to me. It's discrimination because while you're a doctor, you're not supposed to have mental health issues. I mean, that really gets me mad because doctors are human beings. Back in the old days, and I'm talking like when my mom is 90, so back in her day, doctors were looked up to like gods, and they acted like it. Not all of them, but they had that attitude. That's changed. Medicine is changing. That's changed. Doctors are not God. They are human, just like the patient. Doctors are patients also, and we have to keep this in mind. I mean, what is the American Medical Society and the licensing board like? Are they going to do something to help you all?
Yeah, I mean, I think there are quite a few efforts at trying to, just to give some background, part of the fear among physicians in seeking any mental health is that our medical licensing board applications include questions about mental health history. And there is evidence that shows that doctors are afraid to seek help for mental health, any help for a mental health issue, because they're afraid it's going to damage their reputation or it's going to affect their ability to be officially licensed. And we've seen approximately 2/3 of U.S. state licensing boards do ask that question about mental health. And so that stigma of seeking mental health could kind of follow you for the rest of your career. There have been some efforts to try to remove that question from U.S. state licensing boards. It is a violation of the American Disabilities Act, but so far most applications still include that inquiry into mental health of the applicant.
That's not right. Do they ask if a person went for therapy or if maybe they had a mental breakdown, a nervous breakdown? Like, how personal do they ask about mental health?
That's a good question. I think every application is different. I do know that in some states you do need almost like like if you do declare that you've had a mental health issue, you need to be like cleared by a psychiatrist, or they might request a little bit more detail into the issue, but every state has a different question.
Oh, okay. So it's different in every state, and every state probably has different laws.
Yep.
Concerning that with physicians. So they need to have like a universal across the board in the U.S.
Right.
plan.
Standardize it.
Yes, yes. Where it's not a stigma, because this is what we call a catch-22 situation. Do we, the public, want a emergency room physician to not be stable because they can't go for help? Or do we want a doctor who's stable because they went for help? And when you can't go for help because of the stigma, then what's your alternative to suppress your pain and your hurt? Some doctors go on drugs. Some go to alcohol. Do we want doctors to be going to alcohol, coming in drunk or high on illegal drugs because they're afraid to go for help? Wouldn't it be better if they went for help? I mean, that's my opinion. I'm getting on my soapbox again.
Yeah,
I can't help myself.
I completely agree, and I appreciate your passion on this topic. I think the bottom line is, everyone needs to remember that a physician who's struggling with depression or anxiety or even grief may not really be providing the best quality care to the patient themselves. So it's almost like having an impaired physician. So we have to be able to discuss these issues and be more open about them, but more importantly, not be afraid of any kind of stigma associated with them in order to provide the best possible medical care, which is what we spent years studying and years in training to do. So if we think of it that way, I think we, might be able to change the culture with regards to this issue. But as long as we continue to have a stigma about any kind of mental health issue, I think we're going to be stuck in this state where doctors are committing suicide at a rate, 2.3 times higher than that of the general population.
That is really sad. I just thought of an idea, Dr. Nassef. Do you think it would be beneficial if the individual hospitals, and I know emergency room physicians can work in more than one hospital sometimes, but if the individual hospital would have like a doctor support group, and you just can go there, and you're all emergency room physicians or other doctors, and you can say what's on your mind, and maybe have like a group therapy session. I know some people need individual, but even if a hospital had group therapy, maybe it wouldn't be so stigmatized.
Right.
You know what I mean? Like, just say, hey, once a month we're going to have a group discussion. What are you going through? Let us help you.
I think that's a wonderful idea. I think this is the time where, I have to also put this on emergency physicians and physicians in general. Those support groups do exist in a lot of hospitals. Even during COVID, our small community hospital did offer that service to every healthcare provider if they needed it. And most people didn't take it up, whether that's because they're afraid of, their reputation, or they're afraid of being seen as weak. Everyone has probably different reasons. But I think the onus does fall on physicians as well to kind of stop trying to put on the macho, have a macho attitude and try to just, keep afloat, and to just say what, I do feel sad about what just happened, and I do need to address it. But it's hard. It's hard when that culture has almost been beat into you constantly, that you need to just absorb everything that you see and act like nothing affects you at all. And it's going to be hard to fix that. Like I said, we need a revolution to change and address this problem.
Yes, you definitely do. And I know, being of my age, I will be 63. I was brought up that way. So probably a lot of your doctors could be my age and younger. But definitely the ones I would say that are my age, especially male doctors, are, were brought up, you suck it up. You're weak if you cry. That's, and even if a girl was told that, I was told that too, because that was the culture back then. So yes, it gets drummed into us. Like, what are we doing to our boys? Especially that they grow up, and then boys are more likely to commit suicide because they're afraid to say they're sad. And I think that's a disgrace. I think society needs to change. They need to change how we raise our children. They need to be taught to grieve, because people do die, how to handle loss. People are human beings. When you see death after death, it's sad. It's traumatic. And I think also, Dr. Nassef, and in that COVID crisis, when you're thinking, did I do everything? And you could drive yourself crazy that way too, for lack of a better term, just second guessing yourself. And that has to be hard. And you're married to another physician who's an ER physician. So both of you have tremendous stress, and you have a newborn baby, and you're afraid, bringing it home to him, to each other. That's a lot of stress right there. Folks, doctors are under a lot of stress. And, when you go to the emergency room, thank your emergency room physician, please, and be respectful of what they go through on a daily basis. But with this COVID, really have compassion, which, we should have anyway. But I see how busy emergency room doctors are without COVID. I saw that, and I can't even imagine what it was like. And you're right, Dr. Nassef, that culture has to change for physicians and for everybody. And you were right. At one point in people's lives, you might have to go for therapy. You might need counseling. Nobody should throw stones because you don't know what life has in store for you. And you might face a traumatic, event and need help.
Absolutely. The bottom line is, this is our life. It's an issue of life or death. And we need to remember that we're, just as vulnerable to being sad and being depressed as the next person. And we need to accept that it's okay to ask for help, and it's okay to need to talk about your feelings, like your emotions, your grief, your anxiety, and your fear. It's okay to talk about that. We need to stop, feeling shame about having these feelings. That really is the bottom line.
Absolutely. I agree 100%. I'm glad to hear mental health public service announcements for the general public. That should have been always. It should have been always that way. It shouldn't be looked down on when someone goes for therapy or counseling. It's not a sign of weakness, folks, and I say this all the time. It's a sign of strength. It's a sign of strength when someone says, I can't deal with this. I need to go for help. And it has to start being acceptable. And what do you think can be done, Dr. Nassef? What can a hospital do or the licensing board do for you all? What can the public, what can we do?
I think there needs to be it has to start with physicians. We have to be able to practice self-care. But I think in terms of, the licensing board, there needs to either be, a better way to address these issues or address the presence of that question on an application about your history of mental health issues. And there also just needs to be almost like they need a PSA that says, you know what, physicians, like you don't have to worry about any kind of blowback if you do need, to address a mental health issue or to get medical or to get care for one at any point in your career. There needs to be, we need to talk about that stigma openly, and we need kind of assurances that that's not going to be something that's going to affect our career or affect our jobs or affect our livelihood that, a lot of us spent, 20 plus years obtaining. And I think that would go a long way in helping physicians feel comfortable in, talking about the times that they're struggling and the times that they're grieving.
Absolutely. I agree wholeheartedly. I think the stigma, it has to go away. I mean, I can't get my head wrapped around it of why there's such a stigma and why people would, look down on someone because they admit that they need help. Folks, you don't even know what it's like when you see death over and over again. I know when I used to get pulled to the cancer floor, it was depressing. It was depressing because I knew somebody was going to die. And to see that in the emergency room over and over and the stress and everything, it gets to you. I know doctors, nurses kind of like desensitize to protect ourselves. But how much can you desensitize? We're human. This is the thing that really has to be addressed. And I think the powers that be, whoever they are, really need to get on board and start changing their way of thinking and not asking certain questions for a doctor's renewal of their license. It should not be held against any physician to go for help. Let me ask you this, Dr. Nassef. Is it held against the physician if they are in a drunk driving accident?
Yes, it can be held against a physician if they're in a drunk driving accident. Absolutely.
So to avoid that, and I ask that because if someone doesn't go for help, it could end up that way.
That's exactly.
And it definitely can end up that way, and we don't want that. We want our emergency room physicians to be healthy mentally and physically in all areas, just like we want to be. And the powers that be, I mean, if anyone listens to the show that are the powers to be, come on and talk to me. I want you to come on Chatting with Betsy, and let's get something, going here. Help these doctors.
I think talking about it and just bringing light to it the way that you are is really the best way to start to combat this major issue. So I fully agree. Let's talk about these things. Let's be open about them, because that's going to be, that's how we're going to open the door to solving this problem.
Yes, and I'm sure that, burnout is very common. And when a doctor is going to be burnt out and they leave, there's going to be a shortage of doctors as there is. Do we want more of a shortage? They forecast, a shortage of doctors, especially for us baby boomers. Why make the shortage worse by not facing a mental health issue is just, beyond my comprehension. What else would you like to tell us, Dr. Nassef?
I want, mainly I am so thankful to be talking about this openly. I want, if you are friends with, and not just the ER physician, anyone really who is in healthcare or on the front lines during this very difficult time, reach out to your family and friends who are in this situation. Don't let them feel isolated, because of what we've seen and, the grief that we've endured, seeing a lot of patients very sick or die, it can be very isolating. So my advice is reach out to any of your friends that or family that are on the front lines. Don't let them feel isolated. Look for warning signs. If someone's suddenly, their behavior is different, or there's some kind of substance abuse issue, or they're not, you notice that your loved one's not sleeping very well or feels hopeless or helpless, reach out. These are all warning signs, and don't ignore them, because unfortunately these can snowball very quickly into something very, very bad. And this is, we knew there was going to be a mental health a surge in mental health issues just by virtue of lockdown and isolation and quarantine, but specifically in your friends and family and loved ones on the front line, pay attention to these things and pay attention to any changes, and don't let them feel isolated.
Thank you. And I agree. I agree 100%. What can the public do to help emergency room physicians, Dr. Nassef? Can they contact the American College of Emergency Physicians? Is there a way to contact, so if someone's interested in helping out or supporting, to show support for you all?
Absolutely. So there's a lot of resources on the American College of Emergency Physicians website. There are a lot of ways really to reach out. As one of the spokeswomen for the committee, happy if anyone would like, my information, we can post it on your blog if that's okay, Betsy.
Sure. Mm-hmm.
But we would be, happy. I'd be happy to help direct you in any way. Or the website's actually very good. It's acep.org, acep.org. Is the best way to reach out and help if you feel so inclined to do so.
Okay. Thank you so much, Dr. Nassef. I appreciate your honesty and coming on and your openness. And I wish you all the best. And if you have, want to come back, you're more than welcome. Update and see what is going on. You know what, folks? Not only did I get this press release, but I have to tell you, back in September, I had received one, but the person wasn't able to do an interview with me. It was on Physician Suicide Awareness Day. This is tragic. It's tragic that physicians are afraid to get help. And they're human like everyone else. And my heart goes out to all the emergency room physicians and any physician who needs help and they're afraid to get it because of the stigma. And then they commit suicide, and then people want to know why. Well, this is why, folks, because they're going to be criticized and judged, lose their livelihood. And some people just get in that rabbit hole and they can't get out, and they need help. And we need to throw them a lifeline to get out of that rabbit hole and stay out of the rabbit hole. And I don't care if you're a physician or a cleaning person. Everybody has the right to have mental health taken care of. And if you missed any of this podcast, You can hear it again on Apple, Google, Amazon Music, and wherever podcasts are heard. What I have to say, folks, is I want to thank Dr. Nassef again. Thank you, emergency room doctor. You're welcome. Such a pleasure talking to you. Thank the people. Not only do the emergency room physicians face this stress, and this could be a whole other show if you ever want to come on, Dr. Nassef, but violence in the emergency room. Violence in the emergency room. You need to come on, we could do a show on that. But Sheila Wilson has the show Wine and Cheese, and she's an advocate. She started to stop healthcare violence. This is what also emergency room doctors face and nurses. So, be respectful, be kind. They're there to help you. They're doing what they can to help you, and just let them help you, and then let them be helped. And, the American Medical Society, whoever is in charge of doing this renewal of the license of doctors, you need to get up to the 21st century. You need to get with the program, as they say. We're not going to have any doctors left. This is a serious issue. There's already going to be a shortage of doctors, they predict. We don't need more of a shortage because they died because they couldn't get mental health taken care of. Now, do I sound passionate? You might think I'm overboard. You better believe I'm passionate about it because it's not right. I know as a teenager back in the 70s, and I went for counseling, it was not talked about. It was looked down upon. And it shouldn't be. Everybody should have the right to get mental health care without the stigma, without judgment, without criticism, without fear of losing their livelihood. This is important, folks. This is really important. And I can't stress it enough. And, I am passionate. That's who I am. What you hear is what you get on Chatting with Betsy because I'm being me, and I am passionate about mental health awareness. And I just want to thank, all the healthcare workers and physicians. And, just be kind, okay? We need to be kind. And until we chat again, stay safe, be kind. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio. Bye-bye now.